Congratulations! You have registered and you are now attending the P.R.O Masterclass series of webinars. We call this a P.R.O Masterclass series because it stands for Predictable Retirement Outline. That is what we believe your retirement should be. Predictable. Now, there are 5 webinars in this series. There's one on income, investments, taxes, healthcare, and legacy planning. Now, we believe that these are the 5 parts of retirement that you will need to plan out, have a very detailed, descriptive, step-by-step plan for, in order for you to have a predictable retirement. Now, when you dig into this webinar, I want you to put everything aside. Close all the tabs, make sure that you're in a quiet place, and get a pen and paper ready. We go through a lot of material in each one of these courses, and we go through it pretty quickly. I want you to also keep in mind that these were live at one point, and now what you're watching is a previously recorded webinar. So if you would like to ask any questions during this webinar, to the right of this video you should see a chat box. When you click in there and ask your questions, those questions will be automatically emailed to myself or my team, and somebody will get back to you as soon as possible. Below this video, you will see links to our social media. Please keep in mind that you can go there at any point in time for a lot of free educational content that we like to put out on each one of the social medias to help you with retirement. Now, it's time that we dig into this course that you signed up for. Make sure to check out some of the other ones after you get done with this one. And if you like the content, please let us know. If you would like to hear more about something in particular when it comes to retirement, let us know and we may create a video for that as well. Well, it's time for me to go and for you guys to dig into this webinar. Thanks, and make it a great retirement. All right, so let's get into today's class. Today's presentation is going to be about healthcare planning, and it is part of our Masterclass series in our Predictable Retirement Outline, meaning that this is just one of 5 parts when creating a predictable retirement plan. I want to congratulate you guys again for being here. Just want to get a little bit of housekeeping out of the way before we dig in. For those of you that are watching this live, you will have a chat box to the right where you can ask questions at any time. Those messages are sent privately to me and my team, so nobody else is going to be able to see them, so don't hesitate or feel embarrassed to ask any questions. Those will come to us directly. And for those of you watching the recording, the same chat box or question box should be to the right. Feel free to answer any questions as you have them, and those will get emailed to myself and my team, and we will get back to you as soon as we can. There's a lot of information that we're going to be going through today, and we're going to be doing this fairly quickly. So I do recommend that everybody turn off your cell phones, X out of any other tabs that you've got going on in the internet browser. Make sure that you're in a quiet environment. You've got a pen and some paper available to you, because there's a lot of good information here, but we are going to go through it fairly quickly for the sake of time. So let's go ahead and get started. I do want to start with the disclosures here for all of you attorneys, compliance people, anybody out there that's reading this. We are not part of the Social Security Administration, okay? Nobody here works for the Social Security Administration or the IRS or any other government agencies for that matter. Everything that you're going to be seeing today is for purely educational purposes. We are not making any recommendations for anybody. If you would like to get some recommendations or would like some help with anything in particular, we do recommend that you reach out to a professional. We would be happy to help you. We would be happy to go through everything with you. But as of today, this is not recommendations to go out and take any steps or take any action. We are doing this for educational purposes to get you thinking and also to give you some ideas about what retirement's going to look like. Now, I typically start these off with a quote, and this one's from Peter Drucker that says, "Unless commitment is made, there are only promises and hopes, but no plans." And the reason I put this here is because when it comes to retirement, it is a plan that you need. Without a retirement plan, you are going through retirement based off of hope and just hoping that you make it, hope everything works out okay. And I urge you guys to put together a plan, whether you work with us, you do it yourself, you work with somebody else, whatever it may be. Just put a plan together so that you have something to follow, a step-by-step, detailed, documented plan that's going to help you with all 5 stages of retirement. Well, who am I and why am I the one giving this presentation? My name is Jamin Garabedian. I am a chartered retirement planning counselor. I am also a national Social Security advisor. I am a former senior portfolio manager for one of the largest wealth management firms in the country. And essentially what all that culminates to mean for you is that I've done a lot of studying. I've done a lot of work towards retirement planning and focusing on retirement planning, where a lot of financial advisors out there just focus on a portfolio and the investment side of things. I've always tried to take it a step further and just focus on retirement planning. Now, when you're in your working years and you're younger and you've got all your paycheck coming in and you're investing your money, you're investing for as much growth as possible, that's fine. That's great, actually. But once you get into retirement, the mindset changes a little bit because your living situations have changed. You don't have that income coming in from your job anymore. And you may not be wanting to be invested for as much growth as possible and taking all the risk out there that's possible. You may want to now protect some of that, protect some of your assets, because these assets without a paycheck are now going to need to last you 20, 25, 30, 35 years during retirement. So being risky with those may not be the best strategy for you. On a personal level, I am a father of 3 kids. Depending on when you watch this, we do have a 4th on the way. So they may be born by the time that you guys watch this. I am an avid golfer. And then one of my favorite accomplishments on a personal level is that my family does play a lot of board games, and we do play them quite often. And as of right now, I am the reigning Monopoly champion. I have never been beat in our house. So if anybody likes playing Monopoly, I'd be happy to play with you. But enough about me. Let's dig into the reason that you're here. And today we're going to be covering a lot of information. But if nothing else, I hope you come away from this presentation understanding at least 3 key points. The first key point is that if you do not enroll in Medicare on time, you will pay a monthly penalty. A lot of baby boomers don't know if or when they're supposed to enroll in Medicare, but there are very clear rules about when you have to sign up. If you don't sign up with us within a specific window, you will be assessed a monthly penalty that you'll have to pay for the rest of your life. So please, I urge you to remember that you do need to sign up on time and the correct way following the rules, and we will go over this a little bit. Key point number 2 is that if you do not get the right private insurance to go with Medicare, you may pay too much in premiums and out-of-pocket expenses or cost. Now, the fact that you even need private insurance to go with your Medicare is a surprise to many people. Some people think Medicare covers everything, but that's just not the way it works. In order to have a prescription drug coverage and other coverages for other out-of-pocket expenses, you need to have some private insurance, and we'll show you how that works a little bit. And then the third point is that if you do not plan for higher healthcare costs in retirement, you could run out of money or not be able to get the care that you need, that you expected once you got into retirement. People are usually happy to go on to Medicare when they turn 65 because it provides some relief against some high health insurance premiums, but you must be prepared to factor high future healthcare costs into your retirement budget. And the best time to do that is now. And you'll see what I mean a little bit later during this presentation. The presentation today will be divided into those 3 parts. Part 1, we'll be talking about Medicare, what it is, who needs it, who needs to enroll, when you need to enroll, how do you enroll. Part 2, we'll be discussing the private insurance that goes with Medicare and to understand the public-private partnership that is Medicare. We'll be talking about how much Medicare costs, what it covers, more importantly, what it doesn't cover, and how private insurance integrates with Medicare. And then the third part, we'll talk about how to plan for higher healthcare costs in retirement. And there are 2 reasons why our healthcare expenses will be higher in the future. One reason is inflation. The other is increased need for healthcare services as you get older. One expense that needs to be planned for is long-term care. Some of you may have had experience with a parent or a relative needing some help with activities of daily living, such as bathing, dressing, feeding themselves, or even just keeping up with housework and preparing meals. Many people are surprised to find out that the cost of these services are not covered by Medicare. So it's something to think about there. Okay, let's start with talking about Medicare enrollment. Who pays for healthcare in the United States today? Well, if you're under 65, your health insurance is usually work-based. If you're still working, your employer probably provides health insurance. If you're retired, you might have a retiree plan. Or maybe you've recently left your job and have extended your employer coverage at your own expense under COBRA. Maybe you've purchased your own individual health insurance policy. After age 65, though, Medicare generally pays first. That is, our health insurance system is set up so that once a person becomes eligible for Medicare at 65, most private insurance becomes secondary to Medicare. So, when you incur a healthcare expense, the bill is submitted first to Medicare. After Medicare pays what it's going to pay for, any other insurance that you may have will pay for some or all of the rest of it. The only exception is employer group plans that cover 20 or more employees. So, if you're still working, covered by one of these plans, or if you're covered as a spouse under one of these plans, your employer's plan will actually pay first. And this has implications for enrollment, as we'll see in just a minute. So what this means is that unless you are covered by an employer group plan that covers 20 or more employees, you must enroll for Medicare by the time you turn 65. What if you don't enroll for Medicare on time? Well, the consequences are pretty big. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be. And it will continue for the rest of your life. So you got to make sure to do these things on time. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. So if you have other insurance, it will not pay its share until Medicare pays first. So if you don't have Medicare, you could end up getting stuck with the entire bill because your private insurance won't pay until you have Medicare. And if you don't have Medicare, then that private insurance never kicks in. And finally, your private insurance options might be limited. If you're in poor health or have pre-existing conditions, the private insurers that coordinate with Medicare have to take you in. And finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, the private insurers that coordinate with Medicare have to take you if you sign up for Medicare during your enrollment period. But if you don't, you go to apply for private insurance later, you may not be able to get insurance, or you may be charged a higher premium. So make sure that you sign up for the Medicare when it's time for you. Okay, let's back up a bit and ask, what is Medicare? Well, it's a national health insurance program for people over 65. It was signed into law back in 1965 by President Johnson. It's administered by the Centers for Medicare and Medicaid Services, and enrollment is handled through the Social Security Administration. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Some people under the 65 can get Medicare if they receive Social Security disability benefits. Our discussion today will pertain to the first group of people that are over 65. If you're under 65, you got some special situations going on. We're not going to address much of that today. So if you need some help or need to discuss any of that, please feel free to reach out to a professional. Again, we will be available if you would like to speak with us about it, but I do recommend that you reach out to somebody and get those questions answered. So there are 4 parts of Medicare, and they each cover something different. Part A is for hospital insurance. Part B is for medical insurance, and those are both provided by Medicare. Part C, what's called usually Medicare Advantage, and Part D, Medicare prescription drug coverage. These are typically provided by private insurers that have contracts with Medicare. So this image shows 2 ways to have Medicare. If you go with original Medicare, you sign up for Parts A and B. Then you decide if you want prescription drug coverage under Part D. And this shows drug coverage as optional, but it can be dangerous to go without that drug coverage. So we always recommend that everyone at least look at the prescription drug coverages that are outside of Medicare. And just take it into consideration because it could be quite expensive once you get a little bit older in age for those drug coverages. In step 3, you decide if you want supplement coverage. Again, Medicare shows this as optional, but we think it's pretty important because Medicare leaves a lot of gaps in your coverage. The second way to get Medicare is through Medicare Advantage plan offered by private insurance companies. There are many companies in the area offering Medicare Advantage plans, so if you go this route, it will be important to shop for plans and to find one that meets your needs. Again, drug coverage is shown as optional, but we would recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. So if you're comparing Medicare Advantage plans out there, see which ones do offer the drug coverage as well. Choosing how you take Medicare, it's a big decision and it needs to be individualized, and we can't go too far into depth today because, time constraints, but we can get you around certain pitfalls. So if you're receiving Social Security, when you turn 65, you will automatically be enrolled in Parts A and B. If you're working and covered by an employer group plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Parts A and B, and your coverage will start on the first day of the month you turn 65. Parts C and D are not automatic. If you want Medicare Advantage plan, you'll have to contact the insurance company that's offering it, that you've done your research on and that you've chosen, and then you sign up for Part C through them. Or if you want to stay with original Medicare and have a standalone Part D prescription drug plan, you'll need to decide which insurance company plans you want to go with, and you'll have to proactively enroll in those. You should do this at the same time that you are enrolled in Part A and B, before your 65th birthday. So that's a little bit about how you're going to enroll in Medicare. So what if you're not receiving Social Security when you turn 65? Well, more and more people are continuing to work or at least delay the start of their Social Security in order to receive higher benefits. And if you want to learn more about Social Security and the benefits that are available there, we do have an entire webinar on Social Security, and you can go check that out on our website as well. But in this case, you'll need to proactively enroll in Medicare during Medicare enrollment period. There are 3 main Medicare enrollment periods. The initial period applies if you are not covered in group plans that cover 20 or more employees when you turn 65. If you are covered by an employer group plan because you or your spouse is still working, you have a special enrollment period, which I'll explain in a moment. If you miss either one of these enrollment periods, you can sign up for Medicare during the general enrollment period. Well, the initial enrollment period for people who aren't covered by the group plans at 65 start 3 months before you turn 65, and they last until 3 months after you turn 65. But although it lasts a total of 7 months, you really should plan to enroll in Medicare during that 3-month period before you turn 65. Get it done ahead of time. Then your Medicare coverage will start on the first day of the month that you turn 65. By the way, if your birthday happens to be on the first day of the month, everything is moved up a month. Just pretend that your birthday is in the previous month when you're going through looking at when you can apply. For example, if your birthday is June 1st, your initial enrollment period would actually start February 1st. If you sign up during February, March, or April, your coverage would actually start May 1st. Does everybody understand that? If your birthday's on the 1st of a month, just move everything up a month, and that's how it's going to work for you. Now, talking about signing up for Medicare as a whole, but there are times when we need to break it into parts. Most people will sign up for everything all at once, but there may be times when you'll want to sign up for some parts and not others. If you're still working when you're 65, check with your benefits administrator to see if you should sign up for Part A. We mentioned earlier that if you are covered by an employer group plan when you turn 65, you have a special enrollment period that comes later. However, you may want to sign up for Part A when you first become eligible for it at 65. The reason for this is that it may offer better coverage for hospitalization than what your employer group plan covers. And Part A is usually free, but check with your benefits administrator anyway and just compare the coverages between Part A and what your group plan covers. If your employer group plan is a high deductible health plan paired with an HSA account or a health savings account, and if you want to keep contributing to that HSA, you should not sign up for Medicare Part A. The reason is that once you enroll in Medicare, your HSA contributions have to stop. But let me be clear about this. If you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during your initial enrollment period at 65. I'm going to repeat that one more time just so everybody is clear on it. If you have an HSA and your employer plan covers fewer than 20 employees, you have to drop the HSA and sign up for Medicare during your initial enrollment period at 65. Okay, I hope that's very clear to people. A lot of people tend to get that mixed up or confused. So I want to make sure that we're on the same page there. If you are not covered by an employer group plan when you turn 65, you will want to sign up for Part B during your initial enrollment period, preferably that 3-month period before your 65th birthday. So if you're not working, if you're self-employed, if you're employed by a company that has less than 20 employees, if you're on COBRA, or even if you're receiving retiree health benefits, you want to sign up for Parts A and B during that initial enrollment period before you turn 65. If you signed up for Parts A and B during your initial enrollment period, and if you think you will ever in your life want prescription drug coverage, you should enroll in Part D at the same time. If you go more than 63 days without credible prescription drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. So it's better to just go ahead, get your drug coverage out from the onset, even if you aren't currently taking any prescription drugs. As mentioned before, you have two options. You can enroll in a standalone prescription drug plan if you have original Medicare, or you can get your drug coverage through a Medicare Advantage plan. Think about it. You may not be taking prescription drugs now, but your health will decline as you get older, and you will probably be on some sort of prescription drugs down the road. So you may as well just sign up for the drug plan at the enrollment period. That takes care of the initial enrollment period. Now we're going to talk a little bit about the special enrollment period. This is for people who were covered by an employer group plan that covers more than 20 employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. The best time to sign up is before your current coverage ends. That way, you'll have no gaps in coverage, but you actually have a grace period of several months to avoid the late enrollment penalties. For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, or the drug coverage, it only lasts for 63 days. To summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or your special enrollment period. But to avoid gaps in coverage, which is even more important, you should always sign up before you need that coverage to turn on, or if you're still working and under a group plan, before that current coverage ends. Well, what if nobody ever told you about Medicare enrollment periods and you didn't sign up when you were supposed to? Well, you can still sign up, but now you have to do it during Medicare's general enrollment period, which runs from January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you are outside of your initial or special enrollment periods. Coverage starts July 1st. So as you can see, this could leave you with some coverage gaps. So you really want to avoid having to sign up during the general enrollment period if at all possible. But it may be the only option for some people. The important thing to know is that you can't just sign up for Medicare as soon as you realize you failed to do so. If you're outside the general enrollment period, you're going to have to wait till the next one comes around. Okay. So let's do a quick review of Medicare enrollment periods, because this is very, very important. The initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers more than 20 employees. The best time to sign up is 3 months before your 65th birthday. And the Medicare coverage will start on the first day of the month that you turn 65. Now, the special enrollment period is for everyone over 65 who is covered as a current worker or spouse of a current worker under an employer group plan that covers 20 or more employees. The best time to enroll in Medicare is before that coverage ends. Then your Medicare coverage will start on the first month of enrollment. The general enrollment period is for people who did not attend this presentation today and didn't know they needed to sign up for Medicare during their initial or special enrollment periods. They can sign up between January 1st and March 31st of each year, with coverage starting July 1st. Okay, so those are the 3 enrollment periods. Well, how do I sign up for Medicare Parts A and B? It's quite easy. As I mentioned, if you are already receiving Social Security when you turn 65, you'll automatically be enrolled in Medicare. If not, you can go to SSA, as in Social Security Administration, ssa.gov, G-O-V. Click on Medicare and click on the big Apply for Medicare Benefits button. Or you can do it by phone and calling the Social Security Department at 800-772-1213. If you need any of this information, you forget it, and you want some of this information after this presentation is done, just reach out to us. We'll be happy to help you with it. Part D isn't as straightforward because first you have to decide how you want your prescription drug coverage, whether you want a standalone drug plan or a Medicare Advantage plan. And in either case, you'll be shopping for plans offered by private insurers. Once you've decided on an original Medicare versus a Medicare Advantage, then chosen a specific plan, you need to enroll in Part D through the insurance company or through Medicare, depending on what your plan is. So now let's cover Part 2, which is Medicare and how it works with private insurance. This pie chart shows a breakdown of spending by the average Medicare beneficiary for premiums and services. Almost half of the spending, or about $2,300 here, is for insurance premiums, while about $3,200 is spent on services, including long-term care. Now, total out-of-pocket spending by average Medicare beneficiaries is a little under $6,000. These figures are for 2016, which is the latest information that I had available to me when we put this together. And when it comes to these numbers or any other numbers that we're using today, listen, I understand these do get updated. They do change a little. We are using the most recent information we have available to us at the time of recording, but understand that a lot of these numbers will change over time. For current regulations and current numbers for all of this, feel free again to reach out to us and let us know, and we would be happy to get you the updated numbers. Focusing on the out-of-pocket costs paid by Medicare beneficiaries, they fall into 2 main categories: premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and to private insurance companies offering the drug plans and Medigap policies, or the Medicare Advantage plan. Out-of-pocket costs include deductibles, the portion of the doctor's bill not paid by Medicare, and the services not covered by Medicare. First, let's look at monthly premiums. Part A is free if you or your spouse has paid into Medicare over 10 years. This is one reason most people sign up for Part A when they turn 65, even if they're covered by an employer group plan. It doesn't cost you anything. Part B is different. It costs $148.50 per month in 2021. Part B premium is adjusted for inflation, so it might be higher the next year, and also higher income beneficiaries will pay more. There is a chart breakdown here of how much your adjusted gross income is versus what you're paying for Part B. The Part B premium is paid to Medicare. Part D premiums vary depending on which plan you choose. The Part D premium is paid to the private insurance company whose drug plan you decided to go with. This table shows that Part B and Part D premiums for the different income levels. If you're single and your income is under $88,000, or if you're married and your income is under $176,000, you'll pay the regular Part B premium of $148.50 per month. There will be no income-related adjustments. Your Part D premium will vary, but if you pick a plan that charges the average premium, you'll pay about $40 a month for a total of $188.50 per month for Part B and D. If your income falls into one of these other tiers, you will pay an income-related adjustment on top of the base premium. For example, if you're in the second tier here, you'll pay an extra $59.40 for Part B and $12.30 for Part D on top of your regular premiums. This will bring your total up to about $260 per month. Keep in mind that these are per person, so if you're a couple, you can double these. Also keep in mind, these numbers may, by the time you watch this, not be completely updated, so these numbers might change a little bit. Make sure that you go and take a look at what these numbers actually are before you start creating your plan. Now, your tax return for 2 years ago is what's used to determine the income-related adjustments. For example, the adjustment for 2021 would be based off the income reported on your 2019 tax return. And keep in mind that premiums shown here do not include premiums for Medicare Advantage or Medicare Supplement plans. This is for Part D and Part B only. In addition to premiums, there will be some other out-of-pocket costs under Medicare. If you have to be hospitalized, the first $1,484 in-hospital cost will come out of your own pocket before Medicare starts paying. Some private insurance plans cover this, as we'll see in a minute. The Part B deductible is a reasonable $203 per year. And this is waived for some preventative services such as flu shots and certain screenings. The Part D deductible is $445 per year under the standard Medicare design. But Part D coverage is quite complicated, as we'll see in a minute. After you've met your deductibles, there are some other costs. Medicare doesn't pay your entire medical bill. If your hospital stay exceeds 60 days, you'll be responsible for 371 days or $371 per day up to the 90th day, and then $742 per day up to the 150th day. After that, you pay full cost. Medicare pays the full cost of 20 days of skilled nursing care. After that, you'll pay $185.50 per day for 21 days through 100 days. If you need more than 100 days of skilled nursing, you'll pay the full cost. As for Part B, your responsibility is 20% of the Medicare approved cost. Doctors who accept assignment agree to be paid directly by Medicare and will not bill you on any more than what Medicare approved amount. Doctors who do not accept assignment may charge more. If they don't charge more than 15% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest of the 20% plus 15% over. I know it gets a little bit complicated here, but again, I'm just kind of showing you the idea of how these all work. And then from there, it's all about creating a plan and sitting down with a professional to make sure that you get signed up properly and with the right Medicare plan. Under the standard drug plan design, the beneficiary pays about $445 deductible. Then 25% of drug costs after the deductible has been paid. Then there's small copayment once out-of-pocket spending has reached $65.50. But drug plans vary widely. Some will pay more, requiring you to pay less. It will be important for you to find a plan that covers the drugs you take. After looking at all those out-of-pocket costs that you have to pay, you might be wondering what Medicare does cover. Well, it covers the first 60 days of hospitalization, minus the deductible, of course. It covers 80% of your doctor's bills, and it covers some preventative services. The best reference for finding out what Medicare covers is the Medicare in You book. To get it, you can call Medicare at 800-663-4227, or you can just go to www.medicare.gov. And those are both right there on the screen for you. I'll leave this up for a second so you can write them down. All right, the Medicare and You booklet spends over 20 pages talking about what Medicare covers, and only one page talking about what it doesn't cover. I'm not talking about partial payments. I'm talking about no coverage whatsoever. For the list of services you see here, there is no coverage by Medicare. Now, some of these things you can avoid. Cosmetic surgery is obviously optional. For example, if you never go outside the United States, you don't have to worry about that. But some of these other things may be necessary. Dental work, eyeglasses, hearing aids. These are things that you'll have to cover yourself. This is where private insurance comes into play. Private insurance can cover all or part of your deductibles in those hospital costs after 6 days, or 60 days, And they can cover the 20% of the doctor's bill that Medicare doesn't pay for. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Now, Medicare alone doesn't cover them. Depending on the drug plan you choose, it may cover the deductible, and it should cover most of the costs of certain drugs during the initial benefit period and the catastrophic coverage period. But it won't cover all drugs. Each plan has its own list of drugs called a formulary, and it won't cover much, if anything, in the donut hole. Medicare supplement insurance, commonly called Medigap. Policies are issued by private insurance companies and are designed to fill in the gaps that Medicare doesn't cover. Although they are not affiliated with Medicare, they do have to follow certain federal and state laws designed to protect you. Medigap insurance policies are standardized. They're identified by the letters A through N. So if you buy Plan F in California, it will offer the same benefits as Plan F in New York. However, the premiums can vary considerably from company to company and from area to area. For example, in one Florida county, the monthly premiums for Plan F range from $192 to $465 per month for the exact same policy. That's why it's important for you to carefully evaluate Medigap insurance and not pay too much for it. This table shows the various benefits for various plans. This is the Medicare and You booklet, so you don't have to memorize it. It's all in there. The main thing to remember is that when you are looking at a particular plan, it will be the same as every other plan offered by other insurance companies. So you want to make sure that you don't overpay for the exact same policy you can get somewhere else for less. Now, Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing the care. You may have to use the network's doctors or hospitals. You'll want a plan that includes prescription drug coverage, though. Remember, we talked about that a little earlier. And you may even be able to get extra benefits like vision care. But the benefits and cost sharing for Medicare Advantage plans are different than for original Medicare. So again, you'll need to shop carefully and choose a plan that fits your needs. And this is just a reminder, once again, to shop carefully for private insurance. Medigap policies are standardized, but premiums vary considerably. First, choose a plan that offers the coverage you need. Plan F is the most comprehensive plan there is. Then choose a reputable company offering that policy at the lowest price. And before signing up, check with your provider's billing department to make sure that they process the billing for the company you choose. Otherwise, you'll have to pay the bills yourself and then file a claim to get reimbursed by the insurance company. You just don't want that. Drug plan benefits vary considerably as well. If you don't take any prescription drugs at present time, you can choose the cheapest plan available. You can always switch to a more comprehensive plan later. And if you do take prescription drugs, you'll want to examine each plan and see the drug list to see what kind of coverage is provided for the medicines that you're actually taking. Same with Medicare Advantage plans. Evaluate each plan's offering and cost, and make a clear choice about which private insurance that you're going to go with. And now we come to part 3, planning for the higher healthcare costs in retirement. Here's a look at healthcare spending by gender and by age. Women tend to spend more than men on healthcare, and older people tend to spend more than younger people. A larger part of these higher expenses later in life are for long-term care. So here's what a typical Medicare budget might look like today, considering premiums only. The Part B premium of $148.50, the Medigap premium is about $200, and the Part D drug premium is $40, for a total of $388.50 per month. Considering both premiums and out-of-pocket costs, the typical healthy Medicare beneficiary might spend over $6,000 per year in premiums, non-covered prescription drugs, and other out-of-pocket costs for dental, vision, and alternative. What can cause your healthcare budget to change? Well, two things: inflation and possibly getting sick. As healthcare costs continue to rise, insurance premiums go up as well, and the non-covered services that you pay for yourself also get more expensive. If you get sick, you may need more expensive prescription drugs. And there's always a possibility that as you age, you'll require more non-covered services like major dental work or hearing aids, or again, long-term care. How can you plan for rising healthcare costs when you might be on a fixed income when you retire? Well, one way is to set aside enough funds to cover your future healthcare costs before you retire. Fidelity did a study every year to determine how much the average couple might need at the start of retirement to fund all of their future healthcare costs, not including long-term care. They say that the average couple will need about $300,000. The Employee Benefit Research Institute did a similar study with slightly different variables and came up with $130 for men and $146 for women, $270,000 for couples. But these are just averages. If you live longer than the average life expectancy, or if you have different healthcare needs, you might need more than this. And remember, these amounts do not include long-term care. How many of you know someone who got old and actually needed help, needed that long-term care we keep talking about? We're not necessarily talking about nursing home care. Long-term care can range from someone coming to a home a few hours a week to help with a meal preparation, to a skilled nursing care. The important thing to know is that Medicare and Medigap do not cover this. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, they're not going to pay for it. The average period of skilled nursing care is just 28 days. And when it comes to custodial care for help with activities of daily living, there's no coverage at all. Before you say, oh, I'll never get old and need that kind of help, consider this. 35% of people over the age of 65 have activity limitations. Some of them need help with so-called instrumental activities of daily living, which include things like shopping and cooking. Others need help with things like bathing and dressing. Here we can see the causes of activity limitations for people over 65. More than half of the population suffers from hypertension, and nearly that many deal with arthritis. And these numbers take into account a wide age range. We know that these conditions usually get much worse as you get older. When you're healthy and active in your 60s, it's hard to imagine not being able to bathe or dress yourself. But it's just a fact of life that people need help as they get older. Nearly half of all people over 85 have some difficulty walking, and this in itself can limit the things that you can do for yourself. For most people, the need for long-term care is very gradual. You start out needing help shopping, preparing meals, doing housework, managing your money, traveling. This level of care is often provided by a family member or maybe even a paid housekeeper. Then you get to where you have difficulty with these essential activities of daily living: eating, bathing, dressing, going to the bathroom, transferring from your chair to your bed, and maintaining continence. I know nobody likes to think about these things, but we all know people who have needed some sort of custodial care. Then you get to where you have difficulty with pretty much everything. But this is something that we all have to deal with. And when you get to the level 3 of skilled nursing care, where people are needing 24-hour supervision, They're needing physicians. They're needing disease management and rehab. It just gets more and more cumbersome and expensive. So how much does long-term care cost? Well, it varies with the type of care, of course. The Genworth annual cost of care survey shows us a median cost across the United States about $147 per day, and home health aides about $150 a day. Adult daycare costs about $74 per day on average. However, it can range from $30 to $160. Residents in an assisted living facility can range anywhere from $3,000 to $7,000 per month, depending on location and amenities. The median monthly rate is about $4,300. The most expensive type of care, of course, is nursing home, where residents can get skilled nursing care. A private room ranges from $200 a day to $1,200 per day. The median daily rate is $290. 1 year at this rate, and you're spending over $100,000 in long-term care. Now, none of us want to think about getting old and needing long-term care, but there are some very compelling reasons why we need to. One is to spare your kids or other family members the burden of taking care of you. They might not mind doing your shopping or paying your bills, but if you were to need constant supervision or help bathing or dressing, that's beyond the call of duty, even for the most devoted son or daughter. Another reason to plan for long-term care is to avoid having to spend down assets in order to qualify for Medicaid. This state-run welfare program will pay for your care if you don't have any money, but that's the point. You have to spend down assets to less than $2,000 in order to qualify, essentially leaving yourself destitute. People on Medicaid don't have a lot of choices about the kind of care they receive. And this is another reason to plan for your own long-term care, to be able to direct your own care and obtain the kind and quality of care that you want. When you're paying for it out of funds you've set aside for this purpose, or when you have insurance that is paying for it, you can decide how you will be cared for, whether it's in your home or in an assisted living facility of your choosing. So there's a lot more to say about planning for long-term care, but our time is almost up here. And I want to leave you with 3 reminders to relate back to the 3 key points that we talked about from the beginning of the presentation. Reminder number 1, enroll in Medicare on time. You don't want to be faced with all the penalties if you don't. Reminder number 2 is to shop carefully for private insurance to go with your Medicare. Evaluate all of your options. Choose the drug plan, Medigap policy, Medicare Advantage plans, and make sure that they offer the coverage that you need at the price you can afford. Don't be one of these people who pay way too much for private insurance because they didn't know any better. Make sure that you are shopping these carefully. And the third reminder, plan now for higher healthcare costs in retirement. We know healthcare is expensive and it will continue to get more expensive. So when you're planning for your retirement and figuring out how much savings that you'll need to make your money last, be sure to factor in an extra amount for healthcare. You'll be very glad that you did. Now I want to leave you with this. There's a lot going on here with just the healthcare side of retirement planning. Remember, when we look at healthcare planning, and we're also looking at investments, we're looking at income, we're looking at taxes, and we're looking at estate planning or legacy planning to go along with your healthcare planning. We do have these instructional webinars on all 5 topics. I urge you to go and check those out. And retirement planning can be complicated. So I always ask, why go it alone? One of the things that we're offering anybody who goes through any one of these webinars and watches it till the end like you have today is to sit down with us for 2 one-hour sessions where we will go through your predictable retirement outlay plan. If you currently have a retirement plan put in place, what we're going to do in the first meeting is we're going to address your goals and concerns. We're going to review what plans that you currently have in place, and we're going to look for holes. We want to make sure that you don't have any gaps in your plan. We're going to take a look at your income plan, investment plan, tax plan, healthcare plan, and legacy plan to make sure there's no holes and that they address all of the goals and concerns that you have about your retirement. In the second meeting, we're going to run through the analysis with you to show you your risk, your cost analysis, your income analysis. We're going to look at your Social Security, your taxes, your RMD, your healthcare. We're going to look at it all and show you our analysis of it. give you the good, the bad, and the ugly about your current plan. If you don't have a plan at all, then what we're going to do for you is start going through everything that you need with you. And we're going to show you step by step how to get this plan put together so that you can accomplish all of your retirement goals. Before we take either one of these first two meetings, we will require that you give us a 15-minute phone call. And you'll see a button below here where you can schedule that 15-minute phone call now. This will allow us to speak with you, see what kind of questions you have, get to know you a little bit, explain the process in a little bit more depth with you so that you understand what we're going to be doing, and to make sure that you're a good fit for us and we're a good fit for you and that we can even help you. Now, how much is all this going to cost you? Nothing. We're doing this completely complimentary for anybody who watches our webinars all the way to the end. And this types of analysis and this type of retirement planning, we've seen other advisors and other firms charge up to $2,500 for. We're not going to charge you anything because we believe that everybody needs help when it comes to retirement. There's a lot to it. And if you don't have a plan set up, you need one. You absolutely need one. So who is this for? Anyone that doesn't want to worry about their finances in retirement. Anyone that has any questions about their current retirement and wants a second opinion. Or anyone who's only ever worked with a financial advisor that it's a portfolio manager that's only worried about your investments and maybe touched upon retirement from time to time. That's not us. What we do here is we focus solely on retirement. And so we want to make sure that you get all 5 pieces of retirement carefully analyzed and have a documented, detailed plan in place for each one of them. Who this is not for is the people that aren't planners. You guys just want to go through retirement hoping everything works out. This is also not for anybody who's not willing to make a change. The people that are, it's worked so far, why should I change anything? Well, if that's how you feel, then we're not going to try to change your mind. It is your retirement. It is your life. And so if you're just going to kind of want to hope that it continues to work out, by all means, go for it. And this is also not for anybody who their brother-in-law or their high school buddy is their current advisor. And the reason I say this is because we've had it happen before where somebody will give us a call and they'll go through this process with us. We'll poke a bunch of holes and figure out that they've got a lot of gaps in their plan. And it just causes some tension between them and their brother-in-law, who is their advisor. And they end up not leaving their brother-in-law simply because it is their brother-in-law. But now there's some tension there for them not doing their job to the extent that they needed to. And we don't want to be the reason for that. So let's just avoid that altogether. I will leave you with this. Have a bias towards action. Let's see something happen now. You can break big plans into small steps and take the first step right away. The first step in your big retirement plan is to just schedule a 15-minute phone call. Get that second opinion. Have us take a look and analyze what you've currently got so that we can tell you what holes you have, what gaps you have, or we can reassure you that everything you've got is great and you can just keep going on the way you are. I want to thank you for coming today. I want to thank you for your attention. This will conclude our presentation. If you would like to get any other information or any other educational material or content, please go check out all our social medias. You'll see buttons for those below. And we will also have on our website all of our educational webinars. Please feel free to reach out to us via email or the phone number you see listed there. And that is it for today. I want to thank you again for coming, and let's make it a great retirement.